health organization that focuses on providing Afrocentric solutions. Good morning, Tafazwa.
Good morning, Eve. Thank you for having me back.
Oh, thank you for coming back. And also joining me in the studio, her name is Fadzai Nyamazana, a counseling psychologist, master's student. Hey, Fadzi.
Hi, Eve.
How you doing?
I'm well, thanks.
The way you're chilled, girl. Okay, okay. In the studio also, I have Audrey Nkoma, a psychology student. Hi, Audrey.
Hi, how are you?
I'm good, thanks. So, right, welcome back to Fadzwa. Just a recap, yeah, for some who missed the show last week. We were talking about, that's when we introduced the topic, drug substance abuse in pregnant women. So, yeah, for those who missed out last week, maybe just a quick recap.
Okay, thank you so much, Eve, for this very important topic. We looked at the effects of drug and substance abuse use and abuse in pregnant women, and we were looking at what happens when a pregnant woman takes alcohol, drugs of any nature, or smokes during pregnancy, and we were looking at the effects such as low birth weight, such as abnormalities, be it congenital, be it physical, and even psychological effects, the negative effects that happen will only reappear when a child is probably in their teens. And we were also looking at why women looked at stressors such as financial issues, partner issues. We looked at domestic violence, intimate partner violence, and we looked at the solutions. How can the community be as best supportive as possible in the absence of a hospital or a clinic? Because we always want to rush to say, oh, but there's no hospital. But there are people where this pregnant woman is. And we looked at how the community can be helpful, checking up on pregnant women, checking up on other factors. Her life is not only anchored or led by the pregnancy, but life does not stop happening. There are other social issues that need to be put in place, and just to check if this woman is okay.
Right. Nicely packaged there. So you heard sometimes you're not going to get my drugs, then you give birth to a child and you're thinking, you know what, this child is normal. It was all a lie, etc., etc. But like what Tafazwa said, sometimes they start showing up when the child is only a teenager, or as they're growing up, you start realizing, something is off. So it makes one wonder, what did my parents get up to?
Should we check?
Should we check? Should we do a background check? Like, what were you up to when you were pregnant?
No,
So,
you came out fine.
I came out fine, yeah.
Right.
So let's talk about treatment, yeah? Because we then did touch a bit on what happens to the mom and the child after birth, etc. So let's get into treatment. What then happens?
I think I'm going to let Audrey handle the treatment side of things.
Ooh, hey, Audrey. Let's have it.
Okay, thank you very much. On the treatment, we have counseling and therapy, which is one of the most effective ways for treatment to maternal mental health. This is whereby we offer a safe space to a mother to express her feelings and emotions. And then we also have support groups whereby we let the mothers mix and also share their experiences. For example, we have the Nursing Mother Wellness Circle at Mbuyane Handa, whereby every Wednesday we conduct a group session with them, whereby they share their experiences and emotions, as well as challenges that they may be facing. And then we also have education and resources, whereby we provide maternal mental health talks at the antenatal clinic at Parenya Twa Hospital. This is whereby the mothers share with us their challenges, the distress, and then we provide with them the coping mechanisms. Then we also have mindfulness and relaxation techniques, whereby we share with the mothers that they may meditate to reduce stress, and they may also engage into yoga practices to reduce stress. Thank you very much.
Alrighty, thank you so much for that, Audrey. So just, yes, coming back to you, Tafazwa.
And I think also, as much as Audrey has given the treatment plan that we have put in place, it's a collaborative approach with other professions like the gynecologists, the midwives, and pretty much all the staff in maternity hospitals.
The whole 9 yards.
Yes,
Yeah.
because a psychologist does not work in isolation. We need to work in unison. And what's most important, I think when Audrey is saying meditation, a lot of you are already rolling your eyes. Meditation, as you see, you don't
Okay.
need a serene environment. Yes, it's encouraged. But uri muno muri pafio hapo serene environment haibudi boys down down. But you find a nice quiet corner within the space yawinayo iyoyo, and just find time the same way we find time to praise, the same way you find time to just meditate and self-reflect. Because when we're coming up with treatment plans, our biggest motto is that they should be cultural and homegrown solutions that are applicable to our setting here in Zimbabwe. So you may have heard, Audrey didn't mention any medication, because medication inozoya kuchipata, and we don't self-medicate. It comes from licensed practitioners who know what you need according to your presenting problem.
All right. So last week you mentioned something very interesting, Tafazwa. You mentioned about how sometimes these mothers, you can barely tell that they're on drugs. And sometimes it's only when you go through their belongings then you find things, or sometimes they're stuck in the nappy bag and whatnot. But now, what then happens when somebody walks in and then they're on something, and you said it's not something that you can just tell from looking that this is what's up. So when you then find out this person is on drugs, do you take them by force to take them for therapy, counseling, or it's a decision that they have to make?
So, according to the World Health Organization, we are
Yeah.
bound by what we call quality rights. Patient inima rights, and it's also bound by the human rights as well. But our duty as health practitioners is to advise.
Okay.
And in a case in point where a patient says, "Inina andiskuda, inindiri right," and a lot of times, especially if you are high on something, you want to assure yourself and assure us, convince us that you are fine. And though clearly, sometimes, yes, we do not take it off face value. With Eve has black lips, so it means this is what's happening, or her nails
Yeah.
are untidy and unkempt, this is what is happening. But it's a collective assessment that we use to then say, you know what, Eve, I think we need to detain you. And so we will inform you, this is what is happening, and this is the best way we think possible, given 1, 2, 3, 4, 5. And this is your treatment plan. And yes, I'm sure a lot of people will be saying, in our local hospitals, yes, that's what we do.
Oh, wow,
Because
okay.
if we just detain you against your will. But again, you sign against medical advice if you want to leave, because mangwana tizodopiwa mosha kwenzi takaregera munhu aifanira kunge achibatsirwa achienda. So there are structures in place that safeguard both the practitioner and the patient, and I want to assure the mothers that it's for your best interest and in the interest of mwana watakatarisira tese.
All right. And then what then happens to the child born with withdrawal symptoms because the mom was, a lack of a better word, a druggie? And now mwana ajarwa, and they're going through that withdrawal stage where they are in pain and everything else. What then happens?
Is this to the baby?
Yes.
So when a baby is born, Eve, takambotarange ABGA scale last
Yes.
week.
Uh-huh.
Out of 10 chinonyorwa pama cards ivana or from a medical documents. It's very important. The practitioner looks at that. There's so many assessments that they do. Panoto budamana. Kuti vaone kuti malfunctions ese aripo, be it physical, be it cognitive, alertness, mwana achema here. So babies that have a low ABGA or are born before their time are naturally taken into the neonatal unit. And this is why you find, if you go to like our central hospital here in the capital, we have people that come from out of Harare, which means they've been referred. Practitioner anenge atambira mwana anotoona kuti mwana haana kunyatsomira zvakanaka, they need to be taken for further investigations. So the child will be taken to an institution that has neonatal services that are adequate to ensure that all assessments are done before the baby is taken back home.
Oh, okay.
As well as Amai, as she's also taken in, and pavano pane mishonga yavanenge vachikubaira vakaona isiri kurieta a certain way, they will say, I'm obviously not going to mention mishonga yacho, but they will know.
Suspect.
Yes.
Okay.
And then this is where we come in as psychologists. We will then have a chat with you and find out kuti lifestyle yanga yakambomira sei, because maybe it was missed during pregnancy, but now going forward hamuchakwanisi kuramba muchitora amai nokuti mukaka wamuchapa mwana uchange uine zvamuri kutora izvozvo. So we want to nip it as soon as we see it, and we work together with the patient. Like I said before, haisi force matter, isusu tingoripo pakuyambira and ensuring that we safeguard your health and the baby's health.
All right, thank you so much for that, Tafazwa. So if you're just joining us, it is a special we're bringing to you for the second time. It is wrapping it up today, where we're talking about drug substance abuse in pregnant women. And joining me in the studio, her name is Tafazwa Meki, a registered counseling psychologist specializing in perinatal mental health, and also Fadzai Nyamazana, Fadzi, counseling psychologist, a master's student, and also Audrey Nkoma, psychology student in the studio. And treatment, no prevention actually. Is there a way to prevent this? But before you answer me, you're a listener, you're at home, you probably have questions about what we're talking about. Hit us up on WhatsApp. That's on 072162651. That's on 072162651. Or you can join on the conversation on our Facebook page. So coming back to you, Tafazwa, prevention. How does one prevent all this?
I'm gonna let Fadzi tackle this one because like she does this every morning.
Oh wow!
So I'm gonna
Look at
let
you,
her
Fadzi.
go. I'm gonna let her go all out. And I'll chip in if I need to.
So, Fadzi, let me rephrase it to you. Drug and substance abuse prevention in pregnant women.
Yes. Thank you for this very important topic and this platform to share with our viewers the work that I do every day. Okay, so I would say the first thing and the very important thing is that knowledge is power. If we share as much as we can about these preventative measures that women can take, we can create a better community of mamadas. So I'm saying providing education and awareness to these mothers. We can do this through this talk show that we are doing, through awareness campaigns, and ensuring that, if possible, in each and every institution where they are pregnant women, there is a maternal mental health education talk that happens there on a daily basis, because that's what I do. In South Africa, being based at Parinyatwa, every morning, Monday to Friday, we'll be providing maternal mental health educational talks to mothers. I would also like to include the issue of screening. This involves incorporating regular maternal mental health screening techniques, or making it a prerequisite that every pregnant woman who comes to a facility to seek antenatal services or postnatal services gets this screening. It will help us to know what these pregnant women are going through. It's better to prevent something than to treat it, because it's not everyone who is going to come forth for treatment. So why not nip it in the bud by preventing it through screening? So when I talked about the educational talks that we do every day, there's the issue of stress management.
Okay.
You'll be surprised to see, in as much as we think those pregnant mothers are okay or they're enjoying
The
this
pregnancy,
yes,
the stage,
to
whatever.
motherhood.
Yeah.
They are not. And for some, taking drugs and substances is a coping mechanism because they don't know how to deal with the stresses that they face each and every day. So we teach about coping strategies, coping mechanisms. We first identify what is stressing you, then we offer culturally relevant techniques as Tafadzwa has highlighted. Tikataura zvinhu zviri kunze uko zvekufirst world isi tiri kuthird world, tiri a third world country, munhu anoudza kuti fadziri
We
kuninyepeya,
won't be able to relate. Yes.
they won't relate. So we offer techniques and zvinhu zvinoita kuti arelate in a way. They reduce their anxiety, they reduce their stresses. And some of these things, mutotaura exercise chaiyo. Pane exercise that we do every day but we don't recognize kuti we are doing something that if turned positively zvinotoita kuti zviite zvakanaka. Issue of walking, I always tell the mothers that I say, we call them vasukuru. I always say vasukuru kutofamba chaiko, it's a form of a stress reliever. But handisi kufamba zuva richipisa, handisi kufamba ndichitofunga nyaya dzangu dziya dziya. Tsvaga an area iri safe yekufamba with someone who you can talk to, you can open up to, and you share. Zvinotorelieva izvozvo, but at most times tongotanga way yekuti ndokwanisa kutoprocessa some of the things by enjoying nature, by enjoying God's creation. I can calm down my nerves, I can ease the anxiety and the stress that I will be feeling. And another important thing on prevention is that there should be access to resources to these mothers, because most of them is from the last segment varikuzoita drugs. They are abusing drugs and substances because they don't have the resources. They don't know where to turn for help. They don't even know what they are going through and how to talk about it. So in South Africa, we say we are there for everyone. Someone always listens to you. We are there to listen to you. So do come through South Africa. We offer listening ear. We have the resources. Apart from South Africa, who is there closer to you that you can talk to? In our communities, let's advocate for a creation of resource centers whereby we can offer maternal mental health resources to the women. Because Zvichida South Africa iri kure, but padhuze newe, are there any resources? Are there any support groups? Angachitaura naAudrey aya kuti we do my support groups. Let's create them within our communities so that these mothers can have someone to talk to, they can have resources to refer to, so that they are better equipped, because most of them vamwe havana resources, hence they just think turning to substance and drug abuse is the answer to everything. Thank you.
Thank you so much for that, Fadzi. Tafadzwa, do you want to add anything to that?
Yeah, I just want to give homework to creatives and producers and people like yourself, Eve.
Oh wow, I'm getting homework?
You know, it's your show, but I'm bossing you around.
Okay.
Okay, so we talk about a lot of things. And what is trending on social media right now, and we see there's power in social media, there's power in any type of media. You guys are very important. You know, back in the day when Pakatanganyadze, AIDS, HIV and AIDS, and I call it AIDS because that's what we used to call it before we started knowing that no, it's AIDS and it's an acronym. There were so many adverts, so many dramas, flyers, billboards, etc. So the powers that be who have these modes of communication need to ensure that the message is put out correctly. When we say stop drug and substance abuse, people have seen that. But show us, tell us there's power in sight, there's power in hearing. Our five senses are so powerful. If we see things, it sticks. Like right now, if you ask me billboard, from my office until I get here, I know ukuthi ndishike pa Star FM pane billboard
Right,
ndofana kuona
Jafuna,
noma la
yes.
tena iphapho.
Mhm.
You know, so having them as landmarks can actually help it stick, because sometimes voice ratafadzo rinobowa, voice raIve rinogona kutonakidza kudarika ratafadzo, but tafadzo ndiye ari kuziva. So DJs, presenters, influencers, creatives come up with narratives that help us see how we are. We say AI is killing humanity. We are killing humanity, Tega. Imagine a world where we are the last people on earth.
Oh,
The
wow.
last people, and I say normal in quotes, because now we're giving birth to Anna who have been exposed to different substances during pregnancy,
True.
to different stressors during pregnancy, because you're stressed, you can you partner yako when you're pregnant. It has an effect on the baby. Pane to communicate kumwana that will affect mwana kana abuda achizokura moti akanyarara asindichera. It's because when you were pregnant, this child faced a lot of violence. Their eyes were from violence irikuviolator kurikuitwa amai vake. So we need to take maternal mental health issues seriously, and that is my homework. That is my call to action to people like yourself, Eve.
All right, assignment taken. I'll
Thank
do
you.
it very well, and I'll come get my marks. So maybe just diving into some questions right here. So like I did say, the floor is open to you listeners. You want to, you've got questions, burning questions you want to ask Tafadzwa or Fadzai or Audrey. Hit us up on WhatsApp at 072162651, and we're talking about drug and substance abuse in pregnant women. So this one says, I want your help, guys. Inini, I use my drugs. But handishazvide but kuti ndisiye ivawo ndoyacho mupfungwa dzinowanda, so ndotozongoenda ndichiti ndosiya tomorrow. Please help. Ndoita sei?
Okay. First of all, is he or she pregnant? Unfortunately, they're not there to respond. If they're pregnant, they can get in touch on our number. We'll say it out. It's 0783 0666 and you can get us on Facebook, on Instagram, and that number is also on WhatsApp, and we will respond. And as long as you call that line, we will give you a free therapy and counseling services, and then refer you where we need to, because yes, we may be psychologists, but we're not jack of all trades. We will refer you to other practitioners who do amazing work in their line of work. If it's children, we'll refer you to child practitioners. If it's adults, or if it's, like you say, drug and substance abuse. But I think I must applaud the listener and say that is the starting point. Acknowledging and realizing that something is wrong, and then also saying that they want to stop. Our central hospital at Paringato Hospital has a psychology division. So do come through and you'll get referred to the appropriate place for your rehabilitation procedure to start. In the absence of that, depending on your budget, there are other places that are available that can take you in and help you on your journey to recovery. But again, I want to emphasize, well done on acknowledging that, look, I have a problem, and saying that you want to start, because treatment is intentional and it's personal. A practitioner can come in, but if you're not yet ready, the work will be retrogressive.
All right, dear listener, I hope you got that. And we'll be giving you the number again before we wrap up the show. Yeah. So this one says, "Good morning, Eve. Last week you talked about alcohol. I have only a glass or two a day because of the pregnancy. The cravings get to me. Would this be a problem?" Glass or two.
We talked about this last week.
Glass or two.
And let me put it out there. Someone said to me, came to my inbox and said, Taff, you know what? Thank you. I heard what you said on radio. You said, don't marry a woman that drinks because they will give birth to a baby with a psychological problem.
Word. Oh my
That is not what I said.
Is that what you said?
No, I did not say that. I mean, drinking occasionally and recreationally is okay.
When you're not pregnant.
When you're not pregnant, look,
Okay.
a glass or two. License. I know it's not allowed, but look, you can go and discuss with your gynecologist. But
So what are
according
you
to
saying
me,
about what?
it's not allowed. Actually, for me, it's
Kokana mwana achi. The last week we talked about my cravings and one.
Yeah.
You know how this people be like,
Yeah.
no mwana ndi arukuda, or how they come and get your plate of food because mwana
Mwana
arukuda.
arukuda.
So you know, so now when it comes to alcohol, the craving, I am pregnant and I'm
Mhm.
craving alcohol, so I decide to have a glass or two to just calm my cravings. Is that a problem?
So you see, Eve, the danger in me saying on air like this, okay, a glass or two is fine. And people will say she didn't specify. My periods anonzi. Maviri katatu pazuva.
Mhm.
A glass or two. I don't know, a glass or two every hour.
And
So
how big is this glass?
exactly,
Yeah.
how big is this glass? And what exactly are you taking? Because I'm like a glass of whiskey undiluted.
Ooh.
So you see now, so it's very dangerous. So
Mhm.
please go and see your practitioners, go and see your gynecologist. But Jandino is here.
Mhm.
Do not take alcohol or anything dark. Kana wine pamuviri. 9 months yet.
Yeah.
Yeah, I know. Yeah, but yeah, that's the rule though.
Okay. So answered. Yeah. I think they've been answered.
And I think Eve, I said